Okay. Good morning, everyone, and welcome to May's webinar. My name is Ron Linneman, a benefits consultant with WA Group. A couple housekeeping items before we kick it off here. Today's webinar is going to go about 40-45 minutes. It's going to be purely educational. There are going to probably be some questions that you may have. And so for the sake of time, if you could type those questions into the Q&A at the bottom, we will consolidate those questions and provide a frequently asked questions document and send it out following this webinar. The presentation itself is also available, including the deck slides. If you would like the replay of this webinar along with the slides, please email me. My email address is listed down there, rlinneman@walivebig.com. A quick refresher on who WA is. WA is a 100% employee-owned local risk management firm. You know, one of the struggles right now in the market is the ability to attract employees. Number one, find them, recruit them, attract them, and then keep them. And so one of the areas of focus in today's webinar is looking at different ways to put together a benefits program that can attract that top talent and keep them there at your organization. And really, it has everything to do with understanding the different ways to finance healthcare. And so today's topic focuses on one of those different ways to create a benefits package for your employees. It's a different way to finance your healthcare. So with that, I've asked David Cantu, president of MedSurity, to talk us through what an individual coverage ICHRA is, or an ICHRA. MedSurity focuses on administration, third-party administration for employers, specifically flex spending accounts, health savings accounts, health reimbursement arrangements, and many more. So with that, David, please kick it off. Thank you.
Thanks, Ron, and thanks to WA Group for having me and allowing me to present on the coverage of on the product of the ICHRA. Can we go to the next slide, please? So with the ICHRA, it was legislatively approved and made available to employers of all sizes. It was passed in April of 2019 and made available for the first time on January 1st, 2020. The government, U.S. Department of Health, Human Services, Treasury are estimating that 800 employers over the next 3 to 4 years will shift from some type of group offering or no offering to an ICHRA. And those 800,000 employers, they'll be among about 11.4 million employees and or families that will purchase their health insurance through the individual marketplace with funds assisted through the ICHRA, or the individual coverage HRA. Of those 800,000 people, 800,000 of them would not have previously had insurance. So they were coming from a place where they didn't have access to coverage or couldn't afford the coverage. And now with the employer assisted ICHRA and contributions, they will be covered. And so we'll see a shift from small group or group market, large group, over to the individual market. So those are the projections that Department of Labor, Treasury, Department of Health are predicting based on this new offering accessible for large employers, small employers, employers of any size. So what is an ICHRA? It's an ICHRA pronounced, it's kind of taken on that name in the industry. It's pronounced ICHRA, I-C-H-R-A-H. It stands for Individual Coverage Health Reimbursement Arrangement. Again, it started in January 2020. People are calling this a game changer. We are seeing higher than average participation by employers for a new product launch like this, put out by governmental entities. So it's gaining some steam, it's gaining interest, Employers are evaluating it to see if it's a good fit for them, but definitely making its mark on the industry of providing employer-sponsored assistance for health insurance. So here's some of the detail about what exactly it is. The individual coverage ICHRA, or the ICHRA, allows employers to provide a health reimbursement arrangement to assist employees to pay for premiums for their policy purchase in the individual market. As far as companies, a company of any size, any number of employers, you can have an employee of one, a company of one participant, or 2,000. It doesn't matter how many employees you have. As far as the amount of contribution you make to assist those employees with buying their insurance, there's no cap. You can be as generous as you would like in offering those dollars to help employees buy their individual policy or individual family policy. All the employer contributions that are made through the ICHRA are tax deductible to the business. So they're a write-off, just like group insurance premium or employer portion of group insurance premium would be. There is an option, depending on the employer, to offer a group plan to one class of employees and an ICHRA to another class of the employees. And we'll revisit that point further in the discussion in the presentation, but there are some rules around that. The classes are defined. There's, for example, salary versus hourly, full-time versus part-time, seasonal versus year-round. But the Department of Labor has defined what classes are when offering an ICHRA and when providing different options or different contributions for different classes of employees. They've defined that for us. It must be offered the same way with similar rules to all of the employees in a particular class. But within a class, you can offer different coverage levels. So, 26-year-old versus a 64-year-old. You can do single or employee plus one or family. So you can vary your contribution based on some of those familiar contribution styles that we've all seen or become familiar with. And I think one of the game changers for this, and what really adds a lot of value to the ICHRA, is that the IRS, along with and working with the Department of Labor, made it available to provide a cafeteria plan alongside the ICHRA that allows employees to pre-tax payroll deduct, or to take payroll deductions on a pre-tax basis to pay for any remaining costs of their individual policy that the employer contribution doesn't cover. So now you can take employer dollars that are pre-tax to the company and assistance to the employee, and payroll tax deductions, pre-tax, to help pay for the entire cost of that premium monthly, all at a pre-tax cost. So the employee is saving 30% on their portion and receiving assistance from the employer. And then an added bonus for the employer is that any money diverted from payroll to pay portion of premium, the company saves on payroll taxes. Because the cafeteria plan's allowed to pair with the ICHRA, the company can offer flexible spending account, dependent care, and HSA alongside the ICHRA. The ICHRA is considered a group plan for all intents and purposes. It's an ERISA compliant plan. Depending on your size of company, there are different rules you have to meet. You still have to meet some of the ACA requirements, but and the affordability rules. But if you meet those, you can have a pretty comprehensive benefit offering with a medical contribution, with payroll deductions. So, yep, go ahead. So overall, employer contribution into an ICHRA, employee payroll deductions, all moving towards paying for insurance premium and out-of-pocket medical expenses to pay for individual policies bought from any carrier that your employees are situs or have access to. In the Minnesota market, some key examples would be Blue Cross, Health Partners, Medica, Preferred One, ICHRA with an asterisk, as they have on exchange plans, and there's some rules about that in regards to tax savings. But overall, employer and employee dollars, just like group insurance, pre-tax funding the payment of insurance premium. So which one's better? ICHRA versus group plan. I think we're learning more as more companies put these in place, but the value that the ICHRA offers off the top that I think is easy to identify is, you're moving down the defined contribution path as an employer. Depending on your size, you're looking at affordability, you're defining what you can provide employees each month, what works well with your budget. There's no more surprises around annual medical plan renewals or the health risk of your population. Everyone's buying their own policy. They're guaranteed issue in the individual market, so everyone has the ability to enroll in a policy, and then you're given a defined option. Plan customization and flexibility. There, depending on what county you live in, there are numerous options for you to pick. Low deductible, high deductible, copay options, HSA options. So the employee has a lot of flexibility in picking the plan that best meets their needs. For an employer HR standpoint, you're kind of risk management. You're kind of stepping out of having to try to manage that employee's health risk from your business plan. A lot of medical expenses go hand in hand with total annual budget and management of your business. This would define a fixed cost. Network flexibility in the individual market. There is flexibility, but you're picking primary care providers. Employees are looking for providers that are tied to that plan or tied to the network within that plan. Employee pre-tax payroll deductions. I don't know that we can say that enough. It's a huge advantage, not just employer dollars that are pre-tax to the company are deducted for the company, but the pre-tax payroll. The plan's portable. If they stop working if an employee terminates employment, it's their individual policy. It goes with them. They can continue to keep that insurance. It's a personalized choice. If I'm looking for coverage for myself and spouse and children on the individual market, I'm going to pick the plan that best meets our needs. And then the employee experience. Most carriers provide a robust consumer-facing customer service experience. They understand these folks are managing their own health insurance and expenses. They can answer lots of questions about network and claims. Some of the losses, go ahead, Ron.
I was going to say, one of the things that I wanted to add is you can have both. One of the strategies that we're helping clients out with is the ability to attract and retain part-time talent. And so you may have a group plan specific to your full-time employees, but you're looking to do something for your part-timers. And so an ICHRA can be that solution for that set of population and have that run right alongside your group plan.
Good point, Ron. That's really important. There's a lots of different scenarios that a combination of group plans and ICHRAs can meet the need for, especially if you're an employer trying to retain or even recruit that talent. This is a great combination, 1-2 punch of a solution for you. As far as takeaways that everyone should be aware of, provider networks in the individual market are limited. They are narrow. Lots of times they're HMO. And then premium pricing. Currently in Minnesota, the individual policies are just below small group market plans or pricing. But across the country, on average, they're about even to 10% higher, depending on what state or county your employees live in.
Brings us to our first poll question, which is, are the employer contributions to an ICHRA tax deductible as a group benefit for the employer? We'll give everyone a few minutes, well, actually a few seconds to fill that thing out. Couple more seconds and all right. Is that true?
That is true. Employer contributions to the ICHRA for employee assistance of buying individual policies is a tax deduction to the company.
Perfect.
All right. Thank you. Good question. The so what is allowed or eligible for ICHRA dollars, employer sponsored contributions into the individual coverage HRA? What can the employer dollars be used for? So first and foremost, premium. So if I'm an employee, I can use my ICHRA dollars for individual major medical policy. And when we say individual, we mean individual as a single person or a policy purchased on the individual market for the employee, their spouse, and or their dependents. So all of those are eligible for reimbursement or to use those employer dollars to pay that premium. Also, if I'm 65 or older and I'm on Medicare AB or Medicare C, I can use those dollars to reimburse myself for my Medicare premium. If there's enough contribution from my employer and they've made the ICHRA dollars accessible for some of the 213D or ancillary coverages, I can use those dollars for individual dental, individual vision, hearing, Medicare Part D, Medicare supplements, out-of-pocket, co-pays, or all 213D over, over-the-counter medications, anything that the IRS has deemed a 213D medical eligible expense. So a lot of flexibility on what it can cover, but the employer has a decision making on what their dollars can be used for as part of the ICHRA plan design up front. And so, which really helps define what your contribution might be. What's not allowed, I think, is just as important to be aware of: short-term limited duration insurance, healthcare sharing ministries, fixed indemnity plans, accepted benefit coverage for vision or dental, association health plans, MIWAs or multi-employer welfare, and TRICARE. So if I'm participating in any of those, I can't access or I can't use the employer dollars to pay for those costs or pay for those membership fees for some of those services.
A couple of the scenarios that we see this conversation coming up more and more is typically employees who are pre-65 and they're primarily working just to be on the benefits. And they're not wanting to drop to part-time because then the group benefits would terminate and they wouldn't be receiving an employer contribution if they're not on the group health plan. So providing a benefit, as I mentioned before, to those part-timers who are looking to go part-time and are still able to get a benefit through the ICHRA. The other ones, the other scenario are the over the age of 65 employees who again are staying as a full-time employee and staying on the group health plan because it's less expensive than going on the Medicare market, depending on the employer contribution. So a strategy is developing an ICHRA for part-timers where now these 65-year-olds can go to part-time status, continue working if they'd like, and still receive a benefit from the company. And where you're really seeing a benefit, especially if you're a large group and claims matter or you're self-insured, is now the claims from those 65-plus-year-olds fall off the plan altogether.
Good point. So what does contribution look like? And how do you know, if I'm an employer, how do I start to think about, well, what could this be? You know, if I'm two to 50, you know, my options are pretty much endless. You know, I can make a contribution for those classes that meets my budget. The easiest is a flat contribution for every employee. An example would be $200 to $300 a month. If I've got a number of employees with families or dependents, I might want to vary my contribution by tier: employee, employee plus one, or family. And so I'm giving 200 for a single, 300 for a married person, or $600 for a family. Or I can do 200 single, 400 family, and then for every dependent you have, you get an additional $100 a month. So there's some variety in how you structure the contribution, as long as it's the same across the board for everyone in that class. You can also vary by age. This gets a little more involved, and there are some rules that apply. So I can say, well, look, I want to be fair based on your age. We understand that it costs less for a 26-year-old versus a 64-year-old. But there is a 1-to-3 ratio rule that the Department of Labor and the IRS has put on the ICHRA and the employer contribution. So if I'm a 26-year-old and I'm giving you $200 as your employer, and I'm going to give something more to a 64-year-old, I have to follow a 1-to-3 ratio. So if I'm giving 200 to a 26-year-old, I'm giving 600 to a 64-year-old. And now I'm within compliant. And then in between that, I'm either bucketing the age bands or creating age bands, or moving it up between 200 and 600 to give everyone a fair contribution. And then you can do a variety of both. The math gets a little funny, but you can do a combination of single, employee plus one, family, and tiered, and age banded. So the 1-to-3 ratio still applies. So here are the classes. The classes are defined, and so much like Ron's comments, if you were doing something for part-time only, that is an eligible class. So if you were doing full-time group insurance and part-time receive the ICHRA, that is allowable. And then you can do any combination of these classes as well. But for the ICHRA, these are the defined classes: full-time, part-time, seasonal, bargaining agreement group, employee populations, certain waiting period requirements, salary, non-salary, temporary, non-resident aliens, employees in the same geographic area is an eligible class. So if you had a group of employees in Minnesota and a group of employees in California, you could class out by location, or any combination.
So that brings us to our second poll question. Employers can offer a group plan to one class and an ICHRA to another class of employees. Is that true or is that false? I suppose if you've been paying attention, you probably already know the answer.
If we're doing our job, right, Ron?
I don't think we need to wait a whole lot of time for this one. We can end it right now.
So true, you can offer group insurance to one class and ICHRA to another. So compliance, there's some compliance to this. There is a requirement and a government provided, Department of Labor provided model notice. The model notice is written specifically for the ICHRA, and has to be provided to each employee when the plan starts. So if I'm an employer and I'm offering the ICHRA for the first time and we're starting July 1st, the requirement is that I offer it sometime by July 1st or shortly after. But once I renew and I'm moving into my second year of ICHRA plan offering to my employees, it has to be offered 90 days before. So and that model notice is going to define how you've designed your ICHRA. Who's eligible? What are the classes? What are my contribution amounts per class? When will they receive the money? How will they receive the money? How do they submit expenses? What's eligible to be submitted? So all of those things. And a lot of common questions we get is, okay, so I'm offering an ICHRA. Individual markets open enrollment is October through December 15th for January 1 every year. What happens if I offer an ICHRA to a class or to my employees in the middle of the year? Well, by offering an ICHRA, it triggers a special enrollment period, which means the individual market has to allow them the eligibility to purchase a policy. So that's a nice feature, so that you're not limited to starting this in on or before January. And then it has to offer an opt-out provision. So employees have to be given the ability to waive and not take the ICHRA. A good example is if I have some employees that are low income or low earners, and they are eligible for a subsidy, they have to be given the option to consider the subsidy or the ICHRA participation. If it's deemed unaffordable, if I'm a small employer, the premium tax credit may be a better option for them. One rule to note is that employees can't participate in both. So the ICHRA says either you're participating in your employer-sponsored ICHRA or you're participating in the tax subsidy, but you can't receive benefit from both tax subsidy, premium tax credit, and the ICHRA contribution from your employer. No minimum class requirements to companies if they're only offering the ICHRA to all employees. But if the combination of a group health plan and an ICHRA for certain classes is the right solution, then there are some participation requirements. So if I have less than 100 employees and I want to offer an ICHRA to my part-timers, I would need at least 10 employees that are eligible to participate in the ICHRA. They don't have to participate, they just have to be eligible to participate. And then that number goes up, it changes. If I have more than 200, it's 10%, and then 200 or more employees is 20 employees. So affordability. So if you're on this webinar and you have more than 50 full-time equivalent, you're very familiar with the affordability requirements put on everyone by the ACA. The ICHRA can satisfy the affordability and ACA requirements if the contribution is such or high enough that the employee, when buying their policy or when buying a silver plan on the exchange, costs them no more than 9.78% of the employee's household income. And then we can use, depending on when we're doing the calculations, you can use 2020 rates, but it can be deemed a compliant plan if the employer contribution is high enough. The affordability calculation safe harbor says that you can make your calculation in conjunction with your contribution based on the low cost silver plan of where your company is located or where that employee is located, as long as it doesn't cost them more than 9.78%.
Brings us to our next poll question. All employers have to meet the ACA affordability rules with their contribution design. True or false? Tougher question.
Yeah.
Give it 5 more seconds here. 3, 2, and 1. Okay. What do you think, David?
We're kind of split down the middle here, and for the right reasons. I mean, for the answer is false. Not all employers have to make it affordable. you're only required to meet the affordability requirements if you have 50 or more full-time equivalents. So if you're less than 50 full-time equivalent employees, then you would not have to make your contribution affordable and you have more flexibility.
David, is that something that MedSurety can help employers out with, the understanding of the affordability rules and whether and what they would need to contribute in order to make sure that they comply with those?
Definitely, we provide guidance on all of the rules and all of the safe harbors that the IRS and Department of Labor, ACA, has allowed along with the ICHRA. So we can walk through the rules, help them define or choose which rules they want to build their testing around, and then walk them through how to calculate that. And so there are a number of safe harbors they can use that doesn't require a lot of additional administration. To, most employers don't have household income for their employees. So, and so here are some of those safe harbors. See how that polling question led us right into the next section. The IRS has proposed safe harbors for, you can base it on, location, age-based ban, prior year. So the employer can use the employee's primary work address instead of their home address when determining the availability of the silver plan. So if I'm an employer, situs in Minneapolis or situs in Waconia, I can use the plans available in that county to determine affordability. The age-based bans are coming. We're waiting for further guidance on that, but you can also use prior years. So if I'm looking at making a contribution, for a lot of those companies that put this in place for 2021, well, they were deciding what their contribution was in 2020. So you're allowed to use the 2020 rates for the upcoming year's contribution to meet affordability. It's based on the lowest cost silver plan is all that matters. So it doesn't matter what the employee picks, and it's only based on the employee cost for that lowest cost silver plan. It's unfortunate that the ACA rules kind of have a family loophole. We know that family coverage is going to cost more, but it's just defined as the cost for the employee based on the lowest cost silver plan. As far as income, the IRS allows some safe harbors around W-2 wages, rate of pay, or the federal poverty line. So these are some of those things I mentioned, Ron, that before you decide what your contribution is, if you are a large employer with 50 or more eligible employees or full-time equivalents, you have to pick one of these rates along with how are you going to base it? Is it W-2 wages for the employee along with employer situs silver plan? If you did that, those would be your rules. You have to define it, tell everyone how you're going to calculate it, and then we can start calculating based on employee income to get affordability. So sample design, I'll just walk you through what this might look like initially and what it could evolve to. The simplest and cleanest that we're seeing some employers step into would be for a certain class, it's premium only. We're giving you $400 a month. Depending on your age, that's going to cover not all, but most of your individual policy premium costs for the month. And that's it. That's what the ICHRA reimburses. If you buy an eligible policy, which needs to be off exchange, you're going to get your $400 to reimburse yourself for your monthly premium. Then you can move into the $400 plus premium tax deduction of payroll. So you put a cafeteria plan in, maybe my insurance costs me $600 a month. I will take my employer $400. I want to make a $200 pre-tax payroll deduction, $100 per pay period or $200 per month to pay that premium. And then as we get to design 4, I can also start to, if my employees are buying HSA compliant plans, I can put an HSA account alongside the ICHRA. the employee can put additional pre-tax dollars, or maybe as the employer, I want to make an HSA contribution for those who buy an HSA plan, or I can offer a flexible spending account to cover out-of-pocket expenses, deductibles, co-pays, vision expenses, and so forth. So lots of options here. Go ahead. I can look at different options for full-time versus part-time. Maybe in Design 5, I have a group insurance plan for all of my full-time employees, but for part-time, working 30 hours less per week, I'm going to do employee $200 a month. If you're part-time and married, you're getting $4, and you're getting $50 per child. I've put the cafeteria plan in place, so now you can use payroll deductions to pay for any difference. There's an HSA if you buy a plan, and an FSA to cover out-of-pocket expenses. So you can get pretty comprehensive. Things to consider, 2 to 49 employees, you don't have to worry about the affordability requirement. You may want to make it unaffordable if you think you have some employees that could receive premium tax credit based on their income. So you can assist those that don't qualify for a tax credit, but give those the opportunity to be eligible for a premium tax credit. Employers with 50 or more need to weigh in on the affordability. 75 of people who buy in the individual market are buying HSA compliant plans, so something to note. And you can use, if someone doesn't participate in the individual, the ICHRA plan, they can still participate in your employer offered FSA if they're on spousal coverage. And so that's a kind of a unique feature too, is that the ICHRA allows me as a company to offer a cafeteria plan. The cafeteria plan allows me to offer an FSA. Anyone who waives ICHRA because of spousal coverage can put payroll dollars into an FSA to cover out-of-pocket expenses. Okay. So what you have to think about, there's lots of questions. That's WA group can help you think through a lot of this. What do classes look like? I have a group plan. I want to offer a comprehensive benefit for a certain class that I'm not meeting their needs today. How do we do that? What does it look like? What do contributions look like? What do I want them to be able to pay? How do I contribute to that? How do employer dollars get to the employees first of the month, or a payroll schedule, or annual contribution on day one? There's lots of different options. And then, what do I want it to pay for? Premium only or all expenses that are eligible? And do I want it to be affordable or not? So lots of questions in the design of your employer-sponsored ICHRA. How many of my employees have access to spousal group coverage? How many have access, are going to be participating on this? That'll determine what your contribution might be. How will I be offering HSA and FSA along the ICHRA? Or do I want to? What's my waiting period? What does my turnover look like? All of these things will play into when you want someone to be able to participate, and when can they start participating. And a big part of it from an administrative standpoint is looking for that administrator that kind of helps you operationalize and maintain compliance, right? So we're taking employer dollars that are eligible for a tax deduction. We're taking pre-tax payroll. The IRS, we all know, is watching both of those. We want to make sure that the money is being used for eligible expenses. These are considered group plans. So who's going to create my model notice? They're like group insurance when you put them in place. So you're going to need a certificate of coverage or a summary plan document. Someone has to create a cafeteria plan to allow for the pre-taxation of payroll. Communicating with employees. Someone has to be able to accommodate tracking employer dollars and employee dollars so that they can be reconciled. So lots of different things when you're looking at an administrator to put this together for you. Can they provide reimbursement electronically to get the money deposited into the employee's account? Or can they pay the carriers directly for the employees and make it feel a little more like a group plan? for those employees participating in the ICHRA. So lots of considerations, lots of features, functions, and compliance requirements that should be evaluated, and WA Group can help with that. So thank you for your time. We're at 12:40 right now, and hopefully that was helpful and provided a perspective on ICHRAs.
David, one scenario that has come up where ICHRAs have been extremely valuable are for large groups. So you're an applicable large employer defined by the ACA. You have a number of employees that work full-time hours that qualify for subsidies or subsidized health insurance. And so offering a group health plan is very difficult because you have to meet certain participation requirements. And when you have a number of employees waiving coverage because they're picking up subsidized health insurance, it's very difficult to provide a group health plan, and therefore almost impossible to comply with the Affordable Care Act, and penalties then can arise. So are you seeing that scenario as a good option for an ICHRA? Can you kind of walk through that?
Yeah, that's a great scenario. And so, if I'm an employer, these can be designed so that they are ACA compliant and move you out of the penalty chair, unlike a situation where you're held to participation requirements. You just can't get access because the participation is low. So you can make the contribution affordable for some, but not all, and start to slice into that participation or that ACA requirement penalty. So maybe you pay it for some, but not all, or you can make it affordable, but it's still less than the subsidy that certain employees are receiving based on the premium tax credit. And then you have a compliant plan. It's just that they're getting more via the premium tax credit. So there are a couple of different scenarios where you can start to move yourself, maybe not completely out of the penalty, but in a better position to pay less penalty for a certain percentage of your population.
Excellent. Thank you.
You're welcome.
So just to remind everyone of a couple housekeeping items. If you do have questions, type them in the Q&A. We'll put together an FAQ and email that out to everybody. If you would like a replay of the webinar and/or the slide deck, please email me at rlinneman@walivebig.com. And if you're interested in evaluating this for your company and want to see what it looks like, how it works, is it the right fit, please connect with one of our account executives, myself. Anyone listed here on this sheet can help you evaluate that market for you. So with that, David, thanks for your time. Appreciate your knowledge, and thank you for everyone for attending. Have a great day.
You're welcome. Thanks, Ron.